Let's get right to KPIX5's Ann Makovic with the very latest at the live news desk. Ann.
Well, the patient with a confirmed case of this virus is from Seattle, Washington. He lives just north of the city, and he's now isolated from the public in a hospital in Everett, Washington. He's a man in his 30s. He looks like he's going to eventually pull through this, but he had recently traveled to Wuhan, China, where the outbreak appears to have begun. The coronavirus has now killed 6 people and sickened more than 300. It was first identified last month, and today's announcement was the first time the virus was confirmed outside of Asia. We also know the virus now can be transmitted from person to person, but the CDC said that it is unknown right now how easily or sustainably this virus is spreading, and that's prompting increased precautions for travelers in Asia. Travelers with masks, quarantine stations, and temperature checkpoints are common sights, and they're becoming more so now here in the U.S. There are screening stations at San Francisco International Airport, LAX, and JFK. They're now expanding that screening to Atlanta and Chicago. Taking a live look right now at SFO, where passengers arrive on direct flights from Wuhan, China, every Tuesday, Thursday, and Saturday. And right now they are immediately being pulled aside to fill out a questionnaire and have their temperature taken. They're not doing that at the airport in Seattle right now, which is where that man eventually went through. We also know that his flight from China was not a direct flight. So he went through 1, 2, possibly 3 other airports on his way to Seattle, but the CDC wasn't able to tell us at this point which one. Again, they say the risk to the public is low, but they do expect more cases here in the U.S. Back to you.
There's growing concerns about the dangerous coronavirus from China. The number of cases has gone from a few dozen last week to nearly 300 now, and health officials have confirmed that the virus can spread from person to person. Gio Benitez is at JFK Airport here in New York, where they're now screening passengers from China. Good morning, Gio.
Hey, George, good morning. Yeah, the World Health Organization is holding an emergency meeting tomorrow to talk about this virus as more and more people get sick in Asia. And now we're learning this morning that the number of deaths is also growing. This morning, a major development as U.S. officials work to learn more about the mysterious new coronavirus and keep it out of the country. Now we're learning of new cases indicating that the virus has the potential to spread from human to human, proving that it does not only spread from animals to humans. At least 14 healthcare workers in China have now contracted the virus after treating infected patients. At least 6 people have died, and the number of confirmed cases has quadrupled to nearly 300. And it's not just China. Take a look. Since the virus first appeared in the central Chinese city of Wuhan last month, it has spread into neighboring countries like Japan, Thailand, and South Korea. Back in the States, the CDC screening thousands of passengers arriving from Wuhan at JFK, LAX, and SFO. Officials checking temperatures, looking for symptoms similar to the common cold, flu, or even pneumonia as travelers enter the country. At this train station in Hong Kong, passengers getting screened for the virus right off the train. Our Bob Woodruff speaking to one American tourist at the station who decided to cut his visit short.
Is it kind of frightening at all to you that this is starting to spread?
Oh yes, of course, that's why I'm going home.
And this morning, we're seeing reports from The Sun in the UK saying that a British tourist in Thailand, just 32 years old, may be the first Westerner affected by this virus. He's battling pneumonia-like conditions in the hospital right now. But again, we should tell you that so far, here in America, there are no known cases. Michael.
All right, thank you so much, Gio. Our chief medical correspondent, Dr. Jen Aston, joined us now. And Jen, some big new developments.
Yeah.
Human-to-human transmission.
Yeah.
How concerning is that?
It's concerning, Michael, because we have to remember coronavirus normally exists in animals. As recently as just yesterday, there was a suspicion that it could spread animal to human, a suspicion it could spread human to human. Now that's confirmed. And obviously for most people, it's easier to avoid contact with animals than it is to avoid contact with other humans.
And then what about the fact that 14 medical workers, they've been sick as well?
Yeah, that's also significant. According to Chinese reports, all 14 medical workers were taking care of one patient. And what that really brings up is the possibility of this phenomenon known as a super spreader. We saw it in SARS. That's one person who can literally infect hundreds or thousands of people. And again, a lot of this is being informed by the experience with SARS, which so far is causing some concern.
So how worried should people be here in the U.S.?
Listen, we have to emphasize this is a dynamic and evolving situation. U.S. public health officials are still saying that the risk to the U.S. population is low, but we have to be clear. We don't yet know how this virus spreads. We know it can be passed human to human, but we don't know how, and we don't know how severe it is. We're going to be looking for the mortality rate or the death rate with this.
I'm sure we'll be talking to you a lot more about
Absolutely.
this next coming days. Thank you, Doc.
You bet.
So clearly, brothers and sisters, we are seeing a fulfillment of Matthew 24 and verse 7, which tells us that there would be pestilence right before the second coming of Christ. Here it says that nation shall rise against nation, kingdom against kingdom, and there shall be famines and pestilences. That's diseases, that's outbreaks that will take place, and that's what we're seeing with this coronavirus. Now, for those of you that watched our video where we discussed how to prevent pneumonia, and we addressed veganism that was legislated by the UK judge, in that video, we address how to prevent this coronavirus, which is a pneumonia flu-like virus. So please do check out that video on how to prevent the coronavirus or how to prevent pneumonia. We'll put the link to that video in the description box as well as in the comments section below. Let us be faithful to the health message. Let us abstain from all fleshly products, all animal products, that we may strengthen the immune system. Let us abstain from all sugary products as we see that these outbreaks are taking place, that the immune system might be strong in the prevention and the invasion of any bacteria or disease. So, brothers and sisters, we are living in the last days. Let us be faithful to God's truth. God bless.